Radius. Radius is the lateral bone of the forearm. Features of the radius. First, let's see the head. The head is disc-shaped and covered with hyaline cartilage. It has a superior concave surface. The head fits into the radial notch of the ulna and the annular ligament, forming the superior radio-ulnar joint. The head and the neck are free from the capsular attachment and can rotate freely. The radial tuberosity. It lies below the medial part of the neck. It has a smooth anterior surface and a rough posterior surface. This is the nutrient foramen. We have three borders: anterior border or the anterior oblique line, the intraosseous or the medial border, which is the sharpest, and the posterior border. We also have three surfaces: anterior surface, wherein the nutrient foramen opens in the upper part, posterior surface, and the lateral surface. The radial artery is palpated against the anterior surface. The posterior surface presents four grooves for the extensor tendons. The medial surface is occupied by the ulnar notch for the head of the ulna. Attachments of the radius. On the anterior aspect, we have the biceps brachii, the supinator, flexor digitorum superficialis, pronator teres, flexor pollicis longus, pronator quadratus, and the brachioradialis muscle. Posteriorly, we have the biceps brachii, the supinator, the abductor pollicis longus, pronator teres, and the extensor pollicis brevis. Clinical anatomy of the radius. Colles fracture is fracture of the radius 2 cm above its lower end, caused by fall on the outstretched hand. The distal fragment is displaced upwards and backwards. If the distal fragment gets displaced anteriorly, it is called Smith's fracture. Pulled elbow. A sudden powerful jerk on the hand of a child may dislodge the head of the radius from the annular ligament. This is known as subluxation of the head of the radius. It can be felt in a hollow behind the lateral epicondyle of the humerus.